and welcome to the PPN Southeast Psychology Expanded podcast, the podcast that gives NHS psychological professions a personal voice and offers an opportunity to hear about the experience of people working within these roles. We will also be looking at the intricacies and different areas of working as a psychological professional within the NHS. I'm Mel Ray, I'm an assistant psychologist and will be your host for this episode. The PPN South East is a membership network for all psychological professionals and other people who are interested in NHS commissioned healthcare. See our website links in the notes below for more information on the PPN. In today's episode, we'll be talking to Karen Rodham. Karen is a senior lecturer at the University of Chichester, a visiting professor at the University of Staffordshire, and a working health psychologist. In this episode, we'll discuss how Karen got into her role, we'll discuss the different opportunities she's had while working in academia, and we'll also discuss her clinical practice alongside some books she has written around self-help. So without further ado, let's welcome Karen. Welcome, Karen. Thank you so much for joining us today. Are you okay? How are you?
I'm really good. Thanks so much. I'm very excited and slightly nervous at joining you today.
Don't be nervous. We're going to be absolutely fine. We'll just jump in if that feels okay. So it would be great if you could just sort of tell me about what your job role is, how long have you been doing it? Give us a little bit of a flavour of what it is that you do.
Yeah, no problem. I'm currently working at the University of Chichester, where I'm a senior lecturer here. I run the MSc in health psychology here. And so my role now is bringing on the next generation of psychologists, but my specialty is health psychology, and I'm really enjoying running the MSc here. But in terms of time, I think next year will be my 30th year as an academic, which is slightly scary. So I've kind of bobbed up and down the country in various different academic roles, doing different things along the way. So I'm doing that. And outside of my job at Chichester, I am supervising a couple of trainees on a NHS funded training route, which we might get onto at some point. So I'm doing that in parallel with my current job.
Oh, brilliant. And absolutely, I think we definitely need to get into the NHS funded training route. And my assumption is that training route is for health psychologists.
It is. It's a pilot training route. So it's not one it's kind of a test one at the moment. So, yeah.
That's amazing. I'm very, very interested to hear about that. So I guess just for a bit of context, what is a health psychologist? What do they do?
Shall I start with what I see health psychology as being? There may be a health psychologist listening that will be interested in my take on this.
Absolutely.
And I think it kind of depends who I'm talking to and how much depth I go into when I'm trying to explain it. But and I'm aware that human beings are, very, very complicated things that don't fall into one box or another. And you think of clinical psychologists as largely dealing with the mental health side of things, but that puts them in a box as well. And health psychology has more of a focus on the physical health side of things. But we look at how to help people maintain their health. We look at how to help people prevent themselves from getting unwell. We look at people who are living with long-term physical health conditions and how they can live well in spite of. So we do all of that sort of stuff. We do training. We get involved in policy making. But I think if I was to try and say what I think is at the heart of health psychology, I think I'd say it's all about behaviour change. And we become experts in that, though it feels weird to call myself an expert, but that's in effect what you become through training to be a health psychologist. Does that make sense?
That makes absolute sense. And it's so interesting, isn't it, that we have all of these different branches of psychology when inevitably, that heart, brain, physical health connection is sort of present everywhere, right? Like, the physical health has such an impact on our emotional state, mental health, and vice versa. And it's really interesting to see sort of health psychology as the branch of psychology that kind of tries to I don't know, weave those two together and have recovery in all these spaces. It sounds like a really interesting, sounds like quite a challenging role to try and affect behaviour change for people who, but I would assume, are so sort of ingrained in the way that they live their lives and their lifestyles and their own physical health. So sounds really interesting and quite challenging.
Yeah, I mean, well, we've all tried to change the behaviour of our own, haven't we, and failed miserably many times, probably. So yeah, but there's lots of models and theories and techniques that we can use to do that. But thinking back to what you just said about all of the different types of psychology, one of my bugbears is that we call ourselves divisions. And I think that's really sad, because that automatically puts a divide. And I see us as being family. We're members of the same family with lots of core skills and different bits of expertise that we can bring to work together really effectively. And I mean, divisions is what we have with our professional body, but I try and think of ourselves as more of family. I think the word division sows division. So so that was a little Rodder's ramble for you. I'm prone to them, I'm afraid. We have a bell in my class that anyone can ring when we're going too far down a ramble. So feel free to bring me back on track.
No, I love a good ramble. I see what you're saying in terms of that division, and there's been a move sort of in psychology language in the NHS now to practitioner psychologists, which I think is really healthy, because actually, like you said, people specialise in different areas, that's true, but the core values of a psychologist is to support and help and walk with somebody in their recovery journey, whatever that is. So I really, really want to thank you for bringing that point. That's a really, really great point.
There's a move away from adjectival titles in job ads, which isn't happening fast enough, because so I might have health psychologist as my qualification, say, but that doesn't tell you what I've done since qualifying and what other things. And so if I'm excluded from applying for a job because I'm a health psychologist, when I might have all the skills that I've gathered elsewhere along the way, it seems wrong. And same for clinicals and counselling and all the other branches. So I do think it's a good thing. I agree with you that we're moving away from that kind of focus towards a more skills-based focus. Yeah.
Absolutely. And I guess picking up from what you sort of said a little bit, you talked about all of sort of the other things you've done since you qualified. It would be really interesting to sort of hear your journey, maybe whether your health psychology journey was planned. Was this just something that you wanted to do? Did you fall into it? Can you give us a little bit of an overview of sort of your journey to where you are? Does that feel possible?
So I'm someone that became a health psychologist through what was called the grandparenting route. So I did my degree. I took a year out after A-levels and worked in a psychiatric hospital, actually just around the corner from where I'm sitting now. It's now posh houses with a nice cafe, but I worked for a year in there as a nursing assistant. Then I did my degree, finished my degree, fell into a PhD. At that point wanted to do clinical, as did almost everybody. And it was really difficult to get onto clinical training, as it still is. And somebody had said, if you do a PhD, that will make it easier to get onto training. So I thought, oh, okay. And I saw this PhD advertised. It was at the business school at the University of Portsmouth, where I did my undergrad, but it was in a health related topic. So I applied and was lucky enough to be offered that with a small stipend and just about enough to live on. And I did that PhD for 3 years. And I looked at occupational health professionals and how they navigated their role. It started out looking at HIV and AIDS in the workplace, but I realised that if I was going to understand how people managed health in the workplace, I had to understand occupational health. So a year in, my whole PhD changed, but I still finished within 3 years and did that. And then when you finish your PhD, you're thinking, well, what next? At that point, I didn't really want to do clinical anymore. And so the next, obviously, was to become an academic. And I saw a post advertised in the University of Central Lancashire up in Preston, working in a health school, health sciences school, and got that post. And then I was on my way. I did a year there. One of my external examiners from my PhD was down in Surrey, mentioned there was a post coming up. That was one of the most scary interviews I've ever had. It felt like there were 50 million people in chairs in front of me, and I had no desk and just one chair, and answered lots of questions. But got that post. And so I worked for 3 years in Guildford, in Surrey University, I taught organisational behaviour. And then I got one of the best jobs I've had, which was working as a research fellow at the University of Oxford in the Centre for Suicide Research. And I just loved being in Oxford. I mean, I come from Bognor Regis. I had this chip on my shoulder about being from Bognor. Bognor's a fantastic place to live, but I didn't think anyone from Bognor would be employed at, Oxford. I had the chip on my shoulder. And I had such a lovely time, being in such a wonderful environment and working on such an important project. We looked at, self-harm and suicidal ideation in 15 and 16-year-olds and did a massive systematic review, and were able to make a really, really, good contribution to that world. And then the funding ran out because it was a 3-year contract. And I saw a post at the University of Bath and joined them. And that is where I heard about health psychology. So I'm coming back to health psychology now. And so I started teaching in the field of health psychology and learned what it was about. I was working with Susie Skevington, who did lots of work in the field of quality of life. She told me I had to go to the Division of Health Psychology conference. Or she strongly suggested, and when someone strongly suggests, you have to go. So I went along, and it was like I'd found my tribe. It was wonderful. And the division was looking for just a member on the committee, so not a particular role, just a member. And I joined, and then pretty soon, I don't know, a year or two later, I was the honorary secretary, working with a number of different chairs. And what else did we do? We ran a joint conference with EHPS in 2008 at the University of Bath. There was like 700 academics come from all over Europe, which was amazing. And had a lovely time getting to know loads of health psychologists in the field. And I stayed at... Yes, do.
Sorry, can I just ask, EHPS, what does that stand for?
European Health Psychology Society. I nearly forgot what the F was. Yeah, so that's our European cousin. So we got the UK division of health psychology and the European one. So we had health psychologists from Europe and the UK on campus sharing all their wisdom, and it was amazing and wonderful. And after that, I think I stepped down from the committee. I was quite tired after running that conference and things, but kept in touch. And then there was a job up in Stoke-on-Trent at the Staffordshire University, which has now changed its name to University of Staffordshire, and got the job there. And at the same time, I was elected chair of the Division of Health Psychology as well. So was then in charge of the DHP for a couple of years. So that was my kind of academic journey. But when I became a health psychologist was when I joined Bath and met Susie Skevington. And she told me about this whole discipline and that there was a route called the grandparenting route. And that's how I joined under the grandparenting route, which was you shared all of your experience and all of your qualifications, and the clever people at the DHP and British Psychological Society looked at it and checked whether you had met the criteria to become a health psychologist. And all of the things that I'd done up to that point had been health related, and I was deemed to be a health psychologist. So it was like I'd found my home. It was lovely. So that was kind of in the early 2000s when I found health psychology.
I think when we think of a psychologist, we think of somebody who's working clinically, and actually hearing a massive amount of experience you've got sort of academically and the changes you're making academically, I think really opens a different route for people that may not have thought, you know, that they could go down that route as a psychologist. Well, I didn't know anything about the grandparenting route, so that's really interesting to sort of hear about that. And do you know if that's still a route?
No longer exists. I was one of the last few to move in through that route at that point. So yes, but that's exciting and scary because suddenly you've got this label. And I mean, I'd done loads of work and I'd done loads of qualitative work and worked with people with all sorts of conditions and all of that sort of stuff. And then while I was at Bath, there were a group of us who were health psychologists, and we were wanting to see if we could get access to patients for research purposes. So we wrote this letter to the local hospital and said, oh, we're health psychologists and we're looking to, you know, work with patients, and you guys are health professionals, maybe looking to do research but don't have time. You know, if any of you are interested in collaborating, here are areas of interest. And one of the consultant people working in pain read it and liked what I'd written and invited me for a chat. And then he invited me to come and sit in on his clinic. And I was in awe of what he did. You know, you have so little time working with these patients, and they'd come in, he'd make them feel comfortable. I'd be sitting in there with them, and he was made them feel at home, checked they were happy with me being in the room, and then did all the things he needed to do. Was lovely, kind of almost dictated the letter whilst they were still there so they could hear what was going in, and then off they'd go. And it was one patient after another. And at the end of the day, I'd seen some of the other team members working, and I said, you haven't got a psychologist. I said, you're doing all these amazing things, but you haven't got a psychologist. You know, and yes, I'd love to work with you research-wise. And then about a week later, he said, well, why don't you come and be our psychologist? And I was like, oh my goodness. And so I went to my boss and said, I've had this invitation. I'd quite like to do a day a week at this local hospital, but I don't want to go part-time. So can you sell me to the hospital for a day? So they pay a day of my salary, but the university still pays me normally. And I didn't understand, you know, pensions and part-time and all of that sort of stuff. So they agreed. I was really surprised. They agreed. They let me do it. So on Mondays, I went to the hospital, and for the first 3 months, I just sat and had one-to-ones with people who had the condition. It's complex regional pain syndrome. And I'd never really heard much about it beforehand. So the first 3 months, really, I sat and asked them to tell me their story. And from that, I designed what I thought would be a really good health psychology part to complement what all the other professionals were doing. And I was there for about 6 or 7 years, one Monday a week, doing that. Absolutely loved it. Learned so much from all the staff, and the patients taught me so much. And I stopped doing it in, I think it's 2013 or 2014. And I gathered all of their wisdom and wrote a book for them, for the patients, that was published in the end. And had such a good time, taught me so much about living with long-term conditions and the challenges and troubles, and about the NHS and about the systems and all of the injustices and all of the amazing work that goes on. So it was really a privilege, but accidental. My life has been accidental.
One of the aims of the PPN Southeast is to support networking and collaboration within the psychological professions. The PPN Southeast hosts 3 amazing communities of practice: a crisis, psychological practitioners, and an aspiring psychologist. These spaces support members to share good practice, network, and have a strategic voice at the PPN Southeast Workforce Council meetings. They also feed into regional meetings and forums, as well as ensuring the opportunity to contribute to any relevant consultations, policy, service, and training developments. Find out more on how to join on the PPN Southeast website.
I know that, especially in my experience, I can't speak for other sort of aspiring psychologists, but definitely in my experience, it feels like every step has to be sort of planned, every step has to be worked towards, your journey has to be like forecast for the next X amount of years. And in hearing that you can make such an amazing contribution by chance, I think fills me with quite a lot of hope that there is still that option. And you've had that opportunity to do research, clinical work, and just sort of really encompass the entirety of health psychology. So thank you so much for sort of taking us along with you in that journey. But now you are a senior lecturer at Chichester.
Chichester. It's a hard word, yeah.
There's no way.
You can say chai. We call it chai.
Chai. Okay. Senior lecturer chai. That makes it feel a bit nicer. And a visiting sort of professor at the University of Staffordshire.
Yeah.
And within those roles, you are, I don't know, spearheading or supporting the pilot of these health psychologists. Now, from what I understood from our little pre-talk, it is training for health psychologists in trusts around the UK that is being sort of pilot funded by NHS England. Now, that's a very brief overcompass of what's happening. So please, can you tell us a bit more and fill in the gap?
Yeah, so I can't take credit for any of this. I'm just a minion in this. Some very clever people spearheaded all of this and made it happen and worked really hard behind the scenes. And if I start trying to name them, I'll forget someone. And so I'm not going to name them. Maybe we can add a link to information afterwards.
100%.
Yeah, it was, it's a pilot to fund health psychologists bringing their expertise into the NHS. And there are 7 trainees, one for each area in England. And the focus of their work is to look at workforce retention and see what health psychology has to offer in that field. And they are also tasked with using one of the health psychology models called the COM-B model, which is all about behaviour change. And the COM stands for capability, opportunity and motivation. And you need those 3 elements for behaviour change to happen. It's much more complicated and evidence-based. That's a very simple explanation of it. But so they're weaving that model underpinning the work that they're doing in their different roles. It's been going for nearly 2 years. So some of them are coming to the end. You have to do, it's part of the stage 2 training route. So to become a health psychologist, there are 2 stages. The first one is doing your MSc, an accredited MSc in health psychology. And the second stage is doing stage 2, which there are a number of different routes, but you can do a professional doctorate course, which I used to co-run at Staffordshire with Rachel Povey. And there are other courses across the UK. You can do it independently while you're working and sign up through the BPS and get supervised. Or you can do a PhD and do the independent route alongside that. So there are a number of different routes to doing it. So this is the independent route. So they're supervised by stage 2 supervisors, and they have a workplace supervisor in the NHS, and they work towards their portfolio of 5 different competencies throughout those 2 years. So my 2 are finishing sort of their training anyway, one at the end of November, one at the end of December. Then there'll be a period of writing up, and then they have their viva, and then they'll be all grown up health psychologists. And the other 5 are at different stages as well, but not, some are ahead, some are a little bit behind, but all be finishing up in this next coming academic year. So it's quite exciting, but it's a real privilege to supervise 2 of the 7 and to see the impact they're having by bringing health psychology into the NHS and to see the people around them appreciating what health psych has to offer. It's been a privilege to just be alongside them and steer them and help them move forward in the direction they want.
It's exciting, and I've got to admit, in terms of my knowledge around health psychology, it isn't big, and the routes to get there, I didn't know a lot about it. So it's definitely very interesting and something I'm going to sort of look at and read about, I think, a little bit more. So thank you for just sort of bringing it to our attention and engaging in that conversation with us. It sounds like you've done a lot of work academically, research and clinically. And I guess when we're talking about behaviour change, it sounds really challenging. It sounds like there are periods where it can be a little bit frustrating. It sounds, it sounds like a big thing, asking someone to change a behaviour that, for a lot of reasons might feel really protective for them. So I guess, what are the things that sort of keep you going in this space that, is challenging? I'm wondering.
Yeah, well, there's nothing worse than someone telling you to do something and appearing that they know better. That doesn't work in behaviour change. So, how do I keep going? I just keep trying to make a little bit of a difference in my area. The last book that I wrote, it's a bit of a cheesy title, I suppose. It was something like Pain Self-Management: The Blame, Shame and Inflame Game.
Snazzy, that one. Very snazzy.
I got a bit annoyed. If I get annoyed, I write stuff, and that doesn't always see the light of day, which is probably very good. But this one did, and there's a drive for many in many long-term conditions. There's a drive towards self-management, which I think is a good thing. But I don't think it's appropriate to call it self-management, because no one can do that on their own. And it started out being called supported self-management, and the supported bit seems to have dropped away. And that feels like an opportunity to blame the individual if they're not coping. So I focus a lot on, I don't know if it's the correct term, but I call it life context. So if I'm working with someone, I need to know all about them. I need to know their background. I need to know where they live. I need to know who they live with. I need to know how they're coping. I need to know how they travel. I need to understand, as far as it's possible to understand anybody else, what it's like, so that then we can work together to create an intervention that will work in their life context. You can't, I believe I can't tell someone what to do. We work together to find out something that will work in their world. And that's really frustrating sometimes, because we think we know best. I mean, quite often we don't, but we think that we do. But for me, it's really important to work collaboratively. So my work is on a one-to-one basis, or small groups. I haven't done big population stuff. So I have that luxury of, focusing in on what's important to them. But unless you understand someone's life context, I don't think you can co-design something that's going to work for them. Because what I think is normal, probably someone else thinks is really weird. In fact, my family call me weird. So, how am I to design something for someone who lives in a very different world? So we work, to me, it's life context that's really super important. And we find a way that will work for them in their world. Because we're both experts in the room, the person who's got the condition and we're experts in different areas. So they're an expert in their life and how it's impacting on them. And I'm an expert in some of the models, theories, interventions, techniques, tools. And together we're much stronger.
Yeah.
So, that's what keeps me going, that and writing grumpy things every now and then.
And you have to, what we'll do for our listeners is we'll get a list of your, some of the publications you've talked about, and we'll make sure that they're available in the links below if we want to read a lovely publication from you, or a Rodder's rant, or whatever you call them. I'm sure they're super interesting. And I guess that kind of brings us towards what I'm sure our listeners now know is my favourite part of the episodes, which is the brilliant last question. So, Karen, looking back on your journey to where you are now, all the things you've done, what's one thing that you wish you knew sort of at the beginning of your journey?
Yeah, so I've listened to your other episodes, so I knew you were going to ask something like this. And I was thinking, oh my God, one thing. So it's really hard, isn't it? Because I wonder if I had known things back then, whether I would have even have listened. Because the journey I've been on has made me who I am now, without knowing that stuff. But I would say, what's my number one thing? Can I have more than one?
You could have more than one.
Okay. So I would say, remember that the race, if there is one, is with yourself, not anybody else. So don't be worrying about what other people are doing. They'll be doing their own thing. I read a book. I've probably not called this. I read it to my students when they're coming up to dissertation time and they're all getting a bit scared. It's a book. I'm paraphrasing the title. It's called something like When Marjorie Laid an Egg, and Marjorie is a cow that lays an egg. And all the chickens are, looking at her weirdly. It's a children's book. It's brilliant. And the students wonder why I read it to them. And it's really to just say, hatch your own egg. Don't worry about what the other people are saying. And I think that's a really important thing, to just focus on your journey and what's right for you, and don't be worrying about other people. That would be a key thing. What else? Try and remain curious, I think. It's really hard because we all make assumptions and judgments, but try and snap out of that and stay naive and ask the naive questions. Oh, that's interesting. What's that like for you? But also try and remain curious and ask yourself those questions. So don't scupper yourself by saying, I can't do that. Really might be worth having a go and see if you could do that. Have a go and try. And I guess two other things. Look outside your own bubble, see what else is going on. Yeah. I think it was Jane Wardle who was an amazing health psych, and she was at a conference keynoting, and she was talking about, I think, obesity, and she mentioned that she got the journal Pig Monthly. And it was like, why is a health psychologist? And at that time they were breeding pigs to be lean. And so she was just looking to see if there's anything health psychology could learn from those magazines. Wow. And I just thought, that's such a brilliant message. Look outside your bubble, see what else is going on. Might be something really useful. And then the last one would be to trust your gut. Your head will mess with you and overthink with you, especially if you're a psychologist. We're so good at overthinking. And your heart will probably get too emotional, but your gut, my gut has always been, when I've taken the time to listen to it, it's usually been right. So I would say those were my things I was thinking about. I don't think there's anything else. I scribbled some things down. Yeah, jump and grow some wings.
I think that's all of those are absolutely brilliant advice. And that idea of just trusting your gut. I think that we spend so long as aspiring psychologists, mainly, knowing where we've got to go, knowing what we have to do, ignoring that gut feeling of when maybe something doesn't feel quite right, but it's someone senior saying it, so we have to go along with it, or this step into training doesn't feel quite right, but that's what I've got to do, or considering another job role doesn't feel quite right, but I need that experience to get here, and we kind of go with the flow of expectation instead of thinking, actually, there's a real reason why I'm feeling a little bit off about this, and it's okay for me to say something. And hearing someone with as much experience as you have sort of saying that, I think really builds a little bit of permission for us to be able to go ahead in our journeys and trust our own gut. So thank you. And that's amazing. Thank you so much for joining us, Karen. It's been an absolutely brilliant time talking to you. I've learnt so much, and I know that our listeners will take a lot from the things we've talked about. So I really appreciate it.
Thanks so much.
Amazing. Thank you so much. That was Karen Rodham, a health psychologist and health psychology academic. Remember, if you want regular updates from the PPN Southeast, then you can become a PPN member by visiting the PPN website. Again, the details are in the show notes below, and the registration for this is free. Thank you for listening. We hope that you have a good couple of weeks, and we can't wait to see you again. Bye.